So today we're going to talk about the severe cuts to SNAP that are being proposed by the House and the impacts that will be felt here in Maine, and also how everyone can take action to reach out to Senator Collins. We are asking that you put any questions you have into the Q&A, and then we're going to have plenty of time for questions at the end. And so I'll start by introducing our wonderful panelists. We've got quite a big group today. So I'm Anna Corson. I am the Policy and Program Director with Full Plates. I'm joined by Colleen Frawley, also from Full Plates, Maddie Whaley from the Maine Organic Farmers and Gardeners Association, Kristen Kinchla from the Maine Children's Alliance, Jess Fay from the Maine Council on Aging, Alex Carter from Maine Equal Justice, Amy Sacy from Good Shepherd Food Bank, Robbie Feinberg from the Maine Superintendents Association, and Annika Moore from Preble Street. All right, so a quick overview of SNAP, which is the Supplemental Nutrition Assistance Program. It provides grocery benefits to low-income households and individuals. And here in Maine, it's very important. We have the highest rate of food insecurity in New England, and SNAP has a really broad reach in our state. There are over 176,000 individuals who received SNAP this February. Around 55,000 of those were children, over 28,000 were older adults, close to 6,000 were veterans, and over 53,000 people were people with disabilities, and over 25,000 were people who were experiencing homelessness. And last year, of all the households in Maine receiving SNAP, 73% included someone who was working. And SNAP is also an economic driver with around 356 million issued in benefits in Maine every year. And that results in nearly $548 million in economic activity. All right, now I'm going to pass it over to Colleen to talk about the proposal coming out of the House.
Okay, thank you. So we are here today because of what's going on in Congress with the budget reconciliation process. So just going to give a quick overview of what's happening with that and why that connects to what we're talking about here in Maine. So right now, Republicans are in control of the House, and they're developing a proposed budget using the budget reconciliation process that allows Congress to write a budget that can pass the Senate with a simple majority vote instead of the 60% that's usually required. And this is a time-sensitive process. So where we are at with the House, is the committees have done their public markup. So they have decided what they want to include, what they want to cut in order to fund the tax breaks that the administration is pushing for. So what we know so far is there are no direct cuts to school meals. Instead, that committee has proposed massive cuts to higher education, which will impact food security in the education space. But we just want to follow up from our last town hall. So as of now, school meals are not in it, but some of those things can be changed outside of this process. And any cut to SNAP is a cut to funding to school meals in Maine. So we're focusing on SNAP today because there's some pretty drastic and historic changes in the House bill, where essentially they want to shift the costs of SNAP to states. So the Agricultural Committee, which oversees SNAP, needs to find $230 billion in cuts to help fund tax breaks for the wealthiest households and corporations. So the bill that came out on May 14th doubled down on the cuts and slashed SNAP by about $300 billion over 10 years. One of the most alarming provisions in the bill is a significant restructuring of the funding model. So right now it's a federal-state partnership, and the federal government pays 100% of food benefits and shares the administrative cost equally with states, who then take the applications and provide the actual electronic benefit. So this proposal would change that by saying that the states need to actually pay some of the benefit and more of the administrative cost. And this, as of now, is proposed to start in fiscal year 2028. So they're also looking at the cost shift depending on being different across states. So it's not equitable. So if we took the error rate now in Maine, we would be looking at a 25% federal funding cut to Maine. And just another factor that we've heard from the state is reductions to SNAP and Medicaid will mean a 20% decrease in WIC caseloads and will impact other child nutrition programs. Next slide, please. So some other things are expanded work requirements and time limits to the benefits, which will negatively, and we're going to hear more about this, but grandparents, older adults, parents with school-age children, there are already work requirements, but they would change in this. The elimination of SNAP Ed altogether, which is a significant program in Maine, and it serves 21,000 SNAP recipients, the majority of them being young people. It provides nutrition education in schools and communities, and it's effective. So over 40% of children who participate report eating more vegetables. So it increases health and healthy eating. Next slide. So it's hard to give an accurate timeline because things are changing daily. But if we're looking at the House proposal, the reason we're looking for action now is that the House has had this public back and forth with committees, and they are trying to get the House to pass this proposal as soon as possible before they break for Memorial Day recess. The Senate is going through a similar process, but behind closed doors. So we have not seen their proposal. So, and the way that the Senate works is a little more complicated and cumbersome. So they both need to eventually agree, right? So we have two representatives in Maine, Representative Golden and Pingree. They have already voted against similar proposals, and they will not vote for this proposal. So we are not worried about them necessarily right now. So what we need is for the Senate's proposal, and it's called a substitute bill or a substitute proposal, right, to come out looking very, very different from what's on the table from the House, so that they cannot agree before the August recess. And ideally, we want our Senator Collins, who is a Republican and involved in this negotiation behind the scenes, to come out publicly and say that she will not support any cut to SNAP, so that throws a little more possibility that there's dissent, essentially. Okay. I will hand it over now to Maddie to hear about the impacts of this locally in Maine on farms and farmers.
Yeah, thank you. Yeah, so I'm Maddie Whaley. I work at MOFGA, where I administer the CSA portion of what's called the Maine Harvest Bucks program. And Maine Harvest Bucks is a program that doubles SNAP dollars when used toward local food. So if you spend $1 on local food with SNAP, you get another $1 to spend on local produce. It's offered at CSAs and farm stands, but also primarily at farmers markets, where it's overseen by Maine Federation of Farmers Markets, who's the lead on that program. And the program also works in partnership with Farm Fresh Rewards, which is another nutrition incentive program that's run by Good Shepherd Food Bank, and stretches SNAP dollars at small grocers as well. So I think it goes without saying that we can go to the next slide. That SNAP cuts would affect these programs and kind of the increased access that we're able to provide to folks through these nutrition incentive programs. And in terms of impacts of SNAP cuts on farmers, nationally, the estimates that I've been seeing are that the proposed cuts would result in $30 billion in farm revenue throughout the US, and that's an estimate by the House Agriculture Committee. And more locally in Maine, we have over 400 farms that directly benefit from SNAP sales. And in 2024, through these nutrition incentive programs, we've seen over $1.4 million in food sales go to local farms. So that's a really significant total that would be affected by these cuts as well. And the participation in these programs have been growing significantly over the years as well. Yeah, and I think it's important to think also about, again, because of how these programs run in Maine, um, because we have a dollar for dollar match, any cut to SNAP, we can think about if that cut were to be spent at local farms, um, that, or if SNAP is to be spent at local farms, that there's essentially double uh, the loss for the dollar there. And also, it's very important to recognize that many of our farmers and farm workers themselves rely on SNAP benefits to feed themselves and their families. And I don't have figures there, but it is a long-standing consideration for SNAP funding. That's all for my slides.
Hi, I'm Kristen Kinchla. I'm a research associate over at the Maine Children's Alliance. We were invited to talk about the impact of these cuts on households with children. Anna and Colleen had mentioned this in their first few slides, but we have the highest food insecurity rate in New England, with 1 in 5 children experiencing food insecurity. There are certain families that are more impacted by this and will be more impacted by the SNAP cuts, and those include households headed by single moms, single dads, and Black and Latino children in the state. And we know that 33% of the households receiving SNAP benefits have children. So that's, 1 in 3 of the SNAP households are directly feeding their kids. And here we have sort of a map to kind of look at what counties might be most affected. So on the left side, you have the percent of children on SNAP. So, the rural counties, Washington County, Piscataquis, Aroostook, almost 1/3 of their kids under age 18 are on SNAP. And then on the right, you have the April 2025 and how many kids are on SNAP in each county. And those numbers change a little, right? Because some of our counties are bigger, so it's not percent, it's numbers. But Penobscot County's got a lot, Cumberland, and Androscoggin. You can go to the next slide. And then we just know that food insecurity, independent of other circumstances, can change how a child's brain and bodies grow. And in those first 5 years of life, without, with suboptimal energy, protein, and micronutrient intake, it can limit their neuroplasticity and lead to impaired cognitive functioning. So it's really important that we don't take away food from kids and make sure that they're getting the best nutrition that they can get in those first early years when their brains are growing and developing. And past that point, we also know that, kids in school who are experiencing food insecurity have trouble concentrating, focusing, learning, and, it affects test scores and it affects how many days they're attending school. And we also know that there's just a lot of increased health problems for kids who don't get enough food to eat. And also that puts them at higher risk of child abuse and neglect, anxiety and depression, and also, just higher rates of emergency room visit and healthcare use. So all this to say, yeah, kids are going to be directly impacted by these cuts in a huge way, especially in Maine. And, with like 30% of our households who receive SNAP having kids in their house, we really can't risk. Yeah, we can't risk going back. SNAP doesn't cover everything right now for these families, but it covers a good portion. And by like tailing this back, we're just going to put ourselves back years on the progress that we've made to reduce food insecurity rates here in the state.
Hey everyone, I'm Jess Fay. I'm the policy director at Maine Council on Aging. And just to let everyone know, for those who don't, Maine Council on Aging is a broad multidisciplinary network of businesses, organizations, and older Mainers, and we advance policy initiatives to ensure that we can all live healthy, engaged, and secure lives as we age in our homes and community settings. Next slide. So food plays a huge role in folks' ability to stay in their homes. And I'll just give you a little bit of data that goes along with this map that you're seeing. Similar to younger people, approximately 23% of the population in Maine is over 65, and that's about 302,000 people. In 2020, Maine had more food insecure older residents than the United States average. This was about 38,000 older adults experiencing food insecurity and 54,000 facing the threat of hunger. So there's the percent of older adults, if you look at this map, receiving SNAP is 10.85% of people over the age of 60 are receiving SNAP benefits. And I just want to note that the report that this map comes from is the Maine Healthy Aging Data Report, which is a really interesting resource. And I will share at the end of this presentation, the links to this map and to the whole report. But you'll also notice, not unlike the prior maps that you were looking at, that the places where the usage of SNAP benefits are higher are similar to those for younger people receiving SNAP. So I just want to quickly mention there are other ways that food for older adults is also under threat. Right now, there are 6,500 older adults and people with disabilities receiving home delivered meals through the area agencies on aging, and 6,000 older adults served at social dining sites. And in another part of the budget, this access to food is also potentially being challenged. So it's kind of a double whammy for older adults, people that depend on Meals on Wheels. That is yet to be seen and part of a different conversation, but just wanted to point out that it's all really connected. So the impacts of food insecurity on older Mainers, like children, lack of nutrition leads to poorer health outcomes, and that can lead to greater need for more expensive long-term care. I'd point out that work requirements don't take into account ageism, and ageism in hiring could impact not only access to healthcare, but also access to nutrition. And one's ability to work can be impacted by access to transportation. Ageism in hiring as well as caregiving. And the Maine Office of Family Independence estimates that work requirement changes could impact about 10,000 adults between ages of 55 and 64 with no school-age children and no disability. Some of those people are older women in particular who are acting as unpaid caregivers for family members, children, parents, and people with disabilities. So having a work requirement could really impact our caregiving workforce as well and leave those families without access to care and access to food. So again, cutting SNAP benefits hurts people across the age spectrum. Thanks.
Hi, everyone. My name is Alex Carter. I use she, her pronouns, and I'm a policy advocate at Maine Equal Justice. And I apologize that my slides are not beautiful and branded as my partners and colleagues here, but Maine Equal Justice is a nonprofit civil legal aid organization and economic security organization. And I just want to level set of why we're all talking about this. Jess just referenced this, but we care about SNAP because we care about people being able to eat. And cuts to SNAP mean quite literally people having less money to buy groceries to feed themselves and their families and taking food off people's plates who I think, as Kinch also mentioned, because of our high food insecurity rates, we really cannot afford to do that here in Maine. And as both Kinch and Jess also mentioned, food security or access to nutrition is a social determinant of health. So if we are concerned about people's health and well-being, we absolutely need to be concerned about children, families, older adults, and everybody having the food that they need to thrive. And SNAP is one of the most proven effective systemic tools we have to combat hunger. And it's also a proven effective public health intervention at preventing a lot of things that Kinch already mentioned. I'm going to chat a little bit about Medicaid as well as some impacts that directly target immigrants. And I just also would like to mention that all of these cuts are not happening in isolation. So many of the same families and individuals will have their SNAP benefits cut, will lose access to their health insurance through Medicaid, their kids may lose access to some vital educational programs, childcare programs, and supports in schools, including the child nutrition programs that Colleen already mentioned. So many of these things will have a cumulative impact, and some of the largest cuts that we are seeing in this House proposal are in Medicaid. Over $700 billion of proposed cuts. I cannot detail them all here. Some of the biggest ones include harsher work reporting requirements, both for parents of school-age kids and older adults. So that would be for the entire expansion population of Medicaid, ages 19 to 64. And I say work reporting requirements specifically because we know that many people who use Medicaid and SNAP do work, and that one of the reasons why a work reporting requirement saves money is because it's cumbersome, both for the state to administer and for individuals to comply with. It's really difficult to get all of your paperwork in on a more frequent cadence, as they are also requesting. So that would be recertify eligibility every 6 months, and a bunch of different renewals. And one thing, in the interest of time, you can go to the next slide, that I want to focus on is, while we understand that this administration and Congress has been targeting immigrants in a lot of ways, they are also targeting immigrants and our entire collective well-being through this House reconciliation proposal. And one of the biggest things that this would do is target states that are covering kids and pregnant people without, well, actually, that's not true. At first, it was going to be just states that were covering kids and pregnant people who were undocumented using exclusively state funds. And now it's been clarified that it's actually states that also provide categories of coverage for lawfully present immigrants using a state option. And that could result in a loss of upwards of $630 to $700 million in our federal Medicaid matching funds. So that when we get to James, he'll talk about the impact on the state budget, but that would have an enormous harmful impact on our state budget and a lot of the things that we care about. And I will stop there and happy to answer any questions.
Good afternoon, everyone. My name is Amy Stacey. I use she, her pronouns, and I'm the Vice President of Government Affairs for Good Shepherd Food Bank. Many of you are well aware that we cannot food pantry our way out of hunger. There are over 600 pantries across the state led by volunteers who are miracle workers, and they absolutely cannot pick up the slack with such a deep and broad federal budget cut. So let's just start right there. The people in pantry lines are hardworking. Many of them do receive SNAP. Many of them do work. And when there are significant SNAP cuts at the state or the federal level, the pantry lines see that difference almost immediately. When we look at previous SNAP cuts and SNAP changes, even over the recent couple of years, the pantry lines were impacted the very next month. So we are very, very concerned about the SNAP cuts that have been proposed by the House Ag Committee. We know that pantries are already experiencing emptier shelves. They're experiencing longer lines because of cuts that already came through this administration year. I also wanted to highlight a change, as Jess Fay said. There are a number of programs supporting older Mainers that we see here at the food bank that are in other parts of the budget, specifically the CSFP box program, which is also known as, it's a senior box of food that we pack and distribute out of our Hamden distribution center. If you've not been, I encourage you to go see the food that is boxed and distributed to over 8,000 older Mainers in the state. And that is, again, in another part of the budget, something that is being considered under elimination. So thank you so much. This is an incredible group of advocates that we have today. Thank you so much for tuning in. A lot of us are really, really worried about this, and the pantries should be the absolute last resort. Cannot fill the gap of SNAP cut. Thank you.
Hi, everybody. Good afternoon. I'm Robbie Feinberg. I'm the Director of Communications and Government Relations at the Maine School Management Association. We represent all of the local public schools in Maine, all the local superintendents and the school boards all across the state. I wanted to just echo what we heard from a couple panelists as well, just about when children have less nutrition. This is one of our biggest things. When there's less nutrition, they are less ready for learning. We see the way in which just their academic outcomes are hurt. So that is certainly one of our biggest concerns around this. But we wanted to highlight as well, I think, a few funding concerns as well, particularly the effect that potential cuts in eligibility for both SNAP and for Medicaid could have on the direct certification process. This has been really important for Maine schools. It removes a big administrative burden, and particularly it says that any child who's enrolled in SNAP or Medicaid, they're automatically deemed eligible for free and reduced price meals. So that means if the school is going to receive federal funding to support those students, even if they're not a community eligibility provision school. So that makes a really big difference. That means a lot more federal funding. It means that that funding doesn't have to come from the state level as well. And so our real concern is that if there are real cuts to eligibility for SNAP and Medicaid, that means that will mean less federal funding directly coming to support school meals and less funding to support our Universal School Meals for All program in Maine that we have seen across the state has been really transformative for students in schools all across Maine. The other important point that is kind of indirectly related to this as well is that direct certification actually impacts school funding as well, where direct certification is used to measure the number of economically disadvantaged students in Maine. So cuts to eligibility for those programs actually means that we'll have a less accurate count of the number of students and families who actually are in need in Maine. And that can actually lead to less funding to the schools that are in most need. So we're really concerned about that piece as well, though that is more indirect. And then the big concern is just this is all happening at a time of so much unpredictability around federal funds. We've already heard about losses of specific grants to schools for behavioral health programs, for certain kinds of school nutrition programs. There's uncertainty around title programs and what will come out of that. So we're particularly concerned, and our group, we're really pushing heavily, and Full Plates is doing this as well, for LD 577, which is a bill that would fully fund Maine's Universal School Meals program. It would give about $6 million to fully fund that program, and would also work to maximize federal funding, whatever that will be, for Maine schools and for School Meals for All as well. So we're really pushing heavily for that in the legislature. We feel like that is a crucial measure to provide some level of certainty to our schools at a time that there is so much uncertainty right now, and really help to limit the impact on what Maine taxpayers, whether locally or statewide, will have to pick up. Thanks so much.
Hi, everyone. My name is Annika Moore. I'm the advocacy team leader at Preble Street. And every day, Preble Street staff in our 16 programs across the state, including veterans housing services, anti-trafficking services, and rapid rehousing services, work with individuals and families facing food insecurity. We know that if this budget reconciliation passes in its current form, it will be devastating for low-income people across Maine, as you've already heard from many of our other panelists today. So I want to talk a little bit about homelessness and housing insecurity and how that relates to these cuts to SNAP. So one very small piece of relief in this bill is that it continues an existing work requirement exemption for individuals experiencing homelessness. But everyone else, especially those who maybe just entered housing or who are trying to avoid an eviction, will lose their benefits if they cannot demonstrate that they completed 80 hours of volunteer or paid work in the previous month. So our caseworkers support individuals every day in navigating the complicated systems that are, in place so that they can access benefits like SNAP. And the harsh work requirements, especially in this draft reconciliation bill, would add an additional barrier for individuals who need to access these benefits and would prevent them from meeting their basic needs. And as Alex mentioned, even if someone qualifies for an exemption or does meet the work requirement, the added burden of submitting a waiver may dissuade some individuals, especially those who already struggle to navigate the system, for applying for benefits in the first place or submitting that recertification paperwork. As I'm sure you're all aware, housing costs have risen uncontrollably in Portland and continue to also rise at a very rapid rate throughout all of Maine. Preble Street caseworkers every day help people find and maintain housing. And we know that what those clients do when their budget gets really tight, the thing that goes first is food. You can't pay partial rent, you can't pay partial childcare, but people can and do cut back on their food intake. And we see this every day in our programs, our Housing First programs, which offer on-site supportive services for individuals who previously experienced chronic homelessness, see that people's refrigerators and cupboards become very bare when they are struggling to access benefits. So we've already seen this, as you heard from Amy, the increased housing costs have already resulted in more people accessing food pantries. Last year, Preble Street distributed over 11,000 food boxes out of our food security hub. And with these proposed cuts to SNAP, there just will not be enough food pantries to replace that food. If those benefits are taken away, there will not be enough food and people will go hungry. So I'd like to pass to James Mile now.
Hi everyone, I'm James Mile. I use he, him pronouns. I'm a policy analyst at the Maine Center for Economic Policy. We are a state-based think tank that works to advance equity and prosperity for all Maine people, and have a focus on folks who are working with low income. I want to talk a little bit about kind of the effects on the state budget from some of these proposals. One of the provisions in the bill relating to SNAP is a new requirement that states take on some of the funding for the program, and based on the way the formula is calculated and Maine's current performance in the program, we could be set to take on 25% of the costs of administering the benefits. Currently, it's a completely federally funded program, which makes it a great deal for the states. But that means we could be looking at paying more than $90 million a year in additional funding just through that provision alone. And then so that's going to present a big challenge to the state budget. I mean, a lot of folks probably already know that the state is facing a tighter budget than usual already before this loss of federal funding. And on this slide, we had prepared kind of showing different versions of the benefit cut and what those would look like. $90 million is close to what the state spends on funding the state police each year, for example. So just in terms of the scale of it and how many issues it may cause for the state budget and putting the funding of other priorities at risk. And then I think there's also going to be, we'll also see kind of ripple effects in the economy as well. We know that spending through SNAP supports state economies, particularly in downturns. Every dollar that the federal government spends on SNAP benefits generates about $1.50 in economic activity as people go out and spend that money at grocery stores, and then the folks who work at grocery stores are then have more wages to be able to spend on other things. So there'll also be a ripple effect of potentially hundreds of millions of dollars more from the folks who are losing their coverage, losing their SNAP benefits, and therefore have less money to be able to spend on things. And we know that those effects are going to be highest in the rural parts of the state where the economy is already weaker than the rest of the state, and where more folks are relying on benefits as a result. So there are a lot of potentially negative kind of economic ripple effects as well from this bill.
Okay, well, thank you so much to all of our panelists. Please go ahead and put your questions for the panelists in the chat. And I'm sure you're all wondering, top question is, what can I do? Clearly, these cuts are going to have significant harmful impacts across the state. So we need everyone to call or email Senator Collins and tell her that Maine needs her to publicly oppose the House budget reconciliation bill and the proposed cuts to SNAP. We have a page on our website with lots of talking points that you can use in your outreach to Senator Collins. So we'll put that in the chat. There's also a folder with social media posts and lots of other resources that you can use in outreach and to share with your networks. So we also ask that you share this call to action with your networks. And we really just want to generate a lot of outreach to Senator Collins' office. If your organization would like to submit a letter to the editor, an op-ed, if you want to circulate a letter around to your network that you can send to Senator Collins, there are resources to support you doing that in the folder that we're sharing. Also, you can sign up for our newsletter called Food Fight that we share lots of updates and opportunities to take action through the newsletter. So the link to sign up for that is in the chat. You can also follow us on social media and share our posts. So now let's move into some Q&A. So if you have questions, please go ahead and put them in the chat. It looks like folks have already been asking some questions and answering some questions. Let's see. Looks like we have a question about, this one looks like it's for you, Jess, about funding cuts for congregate meal sites and Meals on Wheels, and wondering where those cuts are happening and how can people keep track of what's going on.
We actually don't know specifically about cuts. What was in one of the leaked budget documents was a flat fund for those programs. I think of equal concern is the fact that the federal HHS dismantled the Administration for Community Living, which is the organization that was administering these programs and others for the area agencies on aging and for people with disabilities. So that administration has been divided. We don't know where the responsibility is going to lie for the management of those programs, and that is a concern. But if the funding is flat funded for any of the programs that the area agencies on aging utilize, that will be a cut simply based on increased utilization and inflation. So stay tuned, and thank you for paying attention.
Thanks, Jess. And it looks like we have a question in the chat from Greg. It's clear how devastating the cuts to SNAP would be. Should we not be looking at solutions that prepare for the worst case scenarios rather than wait on what goes on in Washington? This is a great question, Greg. I'm going to pass this one over to maybe Alex or James could answer this one, and anybody else feel free to jump in.
I can start and then I'll hand it to James as our budget expert. Yeah, I think it's a great question, Greg. I think many of us have been asking the same thing. I think that unfortunately, given the scale and the scope of these proposed cuts, that not just Maine, but most states cannot fill the gaps left by that magnitude. That amount of money is just not possible for Maine to fill in. I do think there is a moment of advocacy for contingency planning to think about who will be most harmed by all of these proposals at the same time, right? We have a sense, low-income people, people with varying identities that are under threat and attack by this administration already, compounded with their income. But I think what we need to make clear to our federal delegation is that this is just not sustainable for the state. So even if it's being messaged as a cost shift, what it amounts to in practice is a cut in services, a cut in constraints and cuts on eligibility for individuals, because we just know we can't make up that gap for everybody, for everyone. James, is there anything you would add about planning?
I think you covered it pretty well, Alex. Yeah, one of the challenges is just that the funding gaps are so large. I mean, it does speak, I think, to, even though we know that the funding gaps are large, to the need for like legislators to be proactively thinking about, making revenues in the state budget as robust as possible, and thinking, one of the things we know about this budget is that while it's taking food assistance away from folks who need it, it's giving tax breaks to billionaires and millionaires. And so there is an opportunity there, I think, for the state to say, some of those folks who live in our state should step up and pay more to help us, soften some of this blow that's coming. And so I think that's kind of the opportunity we potentially have.
I'd also add that we have seen similar cuts, similar intentional dividing of people living in poverty against each other in the 80s. And the result of that was a significant shift in a couple of things that continue even today. Primarily, before that time, homelessness really was not as robust of an issue as it is now. There were widespread intentional deinstitutionalization strategies implemented in the 80s, paired with lack of community support, paired with, for the first time, cutting the HUD budget in half. So there were wait lists for housing vouchers. All of those intentional strategic policy and funding changes result in what we see all these years later, with the crisis of homelessness, and that is only getting worse, right? So I think that if we think about how we have seen similar significant societal shifts in what we as a community, whether that's your town, the state, the country, accepts as a level of poverty, as a level of the number of people living in poverty, as acceptable narrative of deserving poor, of undeserving poor, of making sure that people really get it right. That welfare queen has really kind of been amplified again in the past couple of weeks and months. So I think it's important that we remember that there has been another time in our history that there were deep, broad policy and funding cuts, and we still feel that impact today. I would also offer that I just want to remind myself and everybody whenever we're talking about this that as advocates, this is really, really hard. As volunteers that care about these issues, it's really, really hard. People living in poverty are terrified. People living paycheck to paycheck, people living right above the poverty line, right below the poverty line, people having to access services for the first time, going to food pantries for the first time. When we talk about these things, I mean, the devastation, there's no word to describe how absolutely terrifying this is for people going into the summer months, and then especially going into next winter. People are already talking with us about, well, what if there's no SNAP, no pantries, and no LIHEAP next year, right? Like, what am I going to do? How am I going to feed my family next Thanksgiving, next Christmas? So I would just offer that let's look at history, let's look at our history, and make sure that we're doing the best we can for those that are the most vulnerable among us, and hearing this message and making sure that we all show compassion. Yes, Preble Street, compassion in action.
Thanks, Amy. That's a really important reminder. And also James's point about progressive tax policy. Policy is hunger is a policy choice. And right now there's an opportunity to make a choice so that people can continue to feed themselves and their families. So unless there are other questions, just going to remind everybody. Oh, we've got another question from Becca in the chat, thinking outside of the box, is there any way to leverage our new right to food amendment to help fight against any of this in any way? That is a great question. I don't know that there are tangible ways to do that with the current policy we have in place with right to food. But I think there are probably opportunities there. I don't know if other panelists want to chime in.
I would just urge as we head into the next round of campaigning and elections in Maine, that those are really important issues that can influence, you know, right now with our administration and our Congress, there's limited appetite for any of this. But as if you know, those are really important issues as we're hearing all the announcements about who's going to run for governor and who's going to, you know, run for Congress. And those are really important issues that will, you know, we can ask quickly. We will be inundated with campaign season.
All right, any other questions? Lifting up Chelsea's comment in the chat about the importance of discussing this particular piece with elected officials. All right, last call for questions. You can always reach out to Colleen and I at Full Plates, and we can direct questions to any of our panelists if you think of something after. But we really appreciate everybody being here today. So one more reminder, the call to action, please reach out to Senator Collins. We really need her to stand up and publicly oppose this proposal coming out of the House. And we need her to take a strong stand against any cuts to SNAP. And again, there are links in the chat to resources to support your advocacy and outreach. We will continue to share updates and opportunities to take action in our newsletter, so please sign up for that. And then last request, we have a very, very short survey. It's 3 questions long that will, when you're leaving the webinar, you'll be prompted. We just want to make sure that these webinars are really helpful and useful. So appreciate any feedback. And with that, give everybody back 10 minutes of their lives to reach out to Senator Collins right now. So thank you so much to all of our panelists. We really appreciate you all. Thank you to everybody who is speaking up right now. And we will continue to fight against these horrible cuts.